I'm Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month, I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness.
So, could you tell us what ketones are and how they are related to mental health?
Yes. So ketones, for number one, ketones are produced in the liver as part of the process of beta oxidation of fat for fuel. So when you're oxidizing fat for energy, one of the molecules that you make when you're doing that are called ketones. And ketones are a couple different molecules. One of them is acetone, which is why when people are on a ketogenic diet and they're peeing on those little strips, and actually if you're ketogenic enough, it just, the bathroom smells like nail polish remover. and that's why, because it is nail polish remover. It's acetone. But the big one is beta hydroxybutyrate, is the name of the kind of the most famous ketone molecule that is being made when you're breaking down fat for fuel. Ketone levels in the blood that are associated with fat metabolism and not eating a lot of carbohydrate will generally ride between, say, 0.5 millimolar and maybe 4 or 5 millimolar. And that's really important because physicians do worry about ketoacidosis, being a thing particularly at risk if you're a diabetic. And when you're ketoacidotic, ketoacidosis will be like 10 times that. So when people are getting to be 40 or 50 millimolar, yes, that is dangerous. That means something's really wrong. But 0.5 to 4 or 5 millimolar is well within the normal range for humans when you're oxidizing fat for fuel and making ketones. Ketones are an energy molecule in and of themselves. And the really interesting thing is that the brain can use ketones directly for energy as an alternative to glucose. So every cell in your body, with the exception of red blood cells in your brain, can basically use fat directly for fuel. In fact, muscles, when they want energy, they can actually use fat that's just sitting there. So you can get subcutaneous fat around your muscles and they can just pull it in for fuel and break it down and use it in the moment. But your brain can't do that. It can't actually use fat for fuel, but it can use the ketones. And there is some suggestion that when you have plenty of ketones, your brain kind of likes ketones better. Mm-hmm. So there's a lot of talk right now about cognitively how well the brain responds to having plenty of ketones around in addition to glucose for fuel. It almost always uses both, but the ratios kind of change. Ketones also appear to modulate inflammation, right? So it's so neat. They're an energy molecule in and of themselves. They're a product of the breakdown of fat. But in addition to that, they also seem to be a signaling molecule, and they modulate inflammation. It appears as though they tell your body to retain lean mass. So now there are some studies out there showing people fasting for weeks and therefore generating a ton of ketones because they're living off their body fat, and they lose almost no muscle during that period. So again, the body is very, very smart. It knows not to chew into muscle when you're living off your fat stores. And it seems to be the ketones are the things that tell it to do that. Ketones also might modulate neurotransmission. There's some suggestion that it improves energy availability in general. And, have you heard someone say type 3 diabetes?
Yes, I have.
And so for dementia, right?
Yes.
And the reason for that, in many cases, if not all cases of dementia, the brain appears to be insulin resistant. So there might be other things going on in dementia, but there's some suggestion that a brain with dementia is floating in glucose and starving at the same time because it can't use the glucose for fuel. But ketones do not require insulin. And there are a couple of published studies in Japan now orally administering ketones, and patients with dementia are improving in a 24-hour period because their brain is being given energy, and that, so it's actually, the lights start to come on, sometimes if you can give people in this situation ketones. And then the last little thing, they also might positively affect GABAergic and glutamatergic transmission. So again, with that, excitability and inhibition, excitotoxicity thing, and ketones may play a positive role in that. And then the whole thing there is that there's a lot more study needed because something really interesting is going on with these molecules.
Yeah. Can you explain the practical ketogenic diet? Because we've probably heard about some extremes, but if somebody was to actually go about doing this diet, how is that recommended?
Well, how is it recommended? You're going to get a lot of different answers. So that's a fair question. And if you look up keto on YouTube, you're going to find hundreds of videos that you probably shouldn't watch. So there is a lot of that going on. Number one, most important thing, right? Ketogenic diet is not new and it's not a fad. I keep seeing this online constantly and actually even being published in magazines that they want to talk about as a fad diet. When the ketogenic diet is about 100 years old, right? It was sort of formally created around the 20s as a therapeutic diet for seizures. And the program still exists at Hopkins. So there is a program at Hopkins for children with intractable seizures, and they put them on a ketogenic diet and keep them in the program for a couple of weeks to really get them going and teach their parents how to feed them. And then they can go home and continue the diet. And it's like 2/3 of them get seizure free.
Wow.
It's really impressive, how well this diet can work for what we think of as intractable seizures that don't respond to any medications that exist for seizure therapy. When you're getting into a ketogenic diet for someone without a seizure disorder, then I would say that the general consensus would be consume no more than about 20 grams of carbohydrate a day, which is about as close to zero as most people can get. And when you think about the things that you eat, I think even an egg technically has about a gram of carbohydrate in it. So you're always going to get a little bit here and there. But if you watch your carbohydrates, you limit to no more than 20 grams a day, then about 30% or less of your daily calories should be coming from protein, and the rest of the daily calories should be made up by fat. And the fat is ideally saturated fat, animal fat, dairy fat, the fat you find in eggs, and then olive oil is generally considered acceptable, coconut oil, so the kind of plant-related fats that are more on the saturated side. And what you don't want to eat are polyunsaturated fats, things like canola oil. And the number one reason for that is that if you heat canola oil more than a couple of degrees, it starts turning into trans fat, right there. So those kind of what some people are starting to call industrial seed oils, which is canola oil, has to be worked on in a factory to about 30 steps before you can put it in your mouth without dying. So that's not really a good idea. But especially on a ketogenic diet, saturated fat's your best friend because that's the most stable, the most heat resistant, and sort of the easiest to digest and deal with by your body. Typically, that is going to be ketogenic diet. Some people will suggest more like 20% calories from protein, 80% from fat. I've even heard 15% calories from protein and 85% from fat. That all kind of depends on your goal. And that, in cases where you're trying to use it to treat seizures, it might be really important to keep the protein, low, like maybe even 15%, and the super high fat. Whereas someone who's more worried about their body composition, a 30-70 is probably just fine. And to go even a step further, I think many people, if they eliminated anything with sugar and anything made of grain from their diet, they're going to be about 90% of the way there, even if they don't think of themselves as strictly ketogenic. Right.
Does scientific research on the ketogenic diet suggest? You've touched on a little bit, but can you share a little more with us?
So I would like ketogenic diets in general in terms of scientific research. I would say that for now, most of the best stuff is ahead of us. One of the best examples, and they're doing this study at Framingham, so that's probably my favorite example on like ketogenic low carb diets. I wasn't part of it, but this study was done with a high carb group of people that are consuming more than 50% of their calories from carbohydrates. And then there was I think something in the middle, and then a low carb carbohydrate where you're like getting below 20, 15, or 10% carbohydrates. And they all had to lose 15% of their body weight to start the study. And then they put them all on these different diets. And what came out of it was that the people eating high carbohydrate or maybe moderate carbohydrate suffered from exactly what you'd think. And the thing that they always talk about on that show, The Biggest Loser, which is that you lose 15% of your body weight and then your basal metabolic rate goes down, and then it becomes extremely difficult to keep the weight off, as though your body was just fighting you all the way. But they found on the people with the low carbohydrate plan that they actually kept the weight off effortlessly, and in testing, their basal metabolic rate actually went up a little bit. And that there's a few interesting thoughts as to why that might be. I mean, number one, their leptin and their ghrelin worked a lot better. So that was something that came out of that. It's also been suggested that protein is a very thermogenic food. You use something like 40% of the calories you could get from protein actually get used to process protein. So your body tends to run hotter when you're eating quite a bit of protein. But in general, I think what the study showed is that whole, the more weight you lose, the hungrier you get and the harder your body fights you is not necessarily true. And a ketogenic diet might be, or even something just close to a ketogenic diet might be the solution for that. The reason why I say the best is yet to come, that study was done, people were able to do it at home, and they were sent food in boxes, and it was all highly controlled. And the researchers had a couple tests that they could do to kind of try to prove that people were doing what they said they were doing. But ultimately, they couldn't be 100% certain of compliance. So they're actually repeating the study in a resort up in Massachusetts. And so they're going to do the study all over again, except for 3 months, people are going to live in a resort and be observed 24/7. So when they do it, they'll be like, well, now we know they ate exactly what we thought they ate, and maybe have an even more credible result. So that's an interesting one, and then more to come.
What is the relationship between mitochondrial dysfunction and the ketogenic diet? What can you share with us there?
Well, a couple things or a couple suggestions. In the ketogenic diet and in the brain, the ketones appear to become a preferred energy source over glucose. And that all around the body, you'll see mitochondria basically doing a better job when they're using fat to generate ATP, or they're using ketones to generate ATP. Almost think of it like you have a car and it can run off gasoline or diesel, but when it's running off diesel, it just does better. The exhaust is cleaner, it's more efficient, and it feels like the engine's going to last longer. Meanwhile, you run it off this other fuel, which might be cheaper and easier to get, but you know that it's kind of breaking your engine. And that seems to be what mitochondria are like when they're literally burning, oxidizing fat and ketones to make ATP as opposed to carbohydrate. So it seems like they become more efficient and less oxidatively stressful. So it might just be that struggling mitochondria do better when you give them better fuel. That might be one answer. But I've also seen a paper that suggested that a ketogenic diet is associated with epigenetic changes that actually improved mitochondrial function and number. So there's some suggestion that somebody could have dysfunctional mitochondria, and if you switch them on a ketogenic diet and look again a year later, you may find that they actually have more numerous and superior mitochondria that are doing a better job, in addition to performing better because they're getting better fuel.
That's fascinating. What are some specific findings about ketosis and bipolar disorder? I know you mentioned a little bit.
Well, a really fun one is this 2019 study in the British Medical Journal. So the authors, they looked at 10 of the biggest online forums for bipolar disorder. Right? So they're looking for the information they can get. So they literally go online and find all of these online support forums where people who self-describe suffer from bipolar disorder talk to each other. and then found like the 10 biggest ones. Then they searched for, text searched for examples of ketogenic diet, which was the active condition. And then they also looked for omega-3 supplementation or a vegetarian diet, which they consider the control condition. So either of those, omega-3 supplements or vegetarian, that's the control, and then ketogenic diet is active. When they combine their data set, those reporting remission or substantial improvement in the ketogenic diet, 56.4%.
Oh.
In the supplementation or vegetarian diet, 14.9%.
Wow.
and then when they looked at remission alone, 12.1% self-reported remission versus in the ketogenic state versus 1.1% on omega-3s or vegetarian diets said that they achieved some kind of remission. So, all survey-based, but a really impressive difference, between self-described people on a ketogenic diet versus people with bipolar disorder moving to a vegetarian diet. Now, there's one big caveat, right? Any practicing mental health professional, if I tell you that someone with bipolar disorder said, yes, I had remission of all my symptoms and I'm off all my meds, sometimes that might not mean what we hope it means.
Right.
That this was online, and you can't really prove how many of those people had bipolar disorder. If you or I were diagnosing it, as opposed to what they're saying when they're on mybipolardisorder.com. But it's an interesting signal. If nothing else, it really shows that again it could really be looked at harder.
What does the scientific literature say about the ketogenic diet as treatment for schizoaffective disorder?
So there are a couple case studies specifically in schizoaffective disorder, and this is the work of Dr. Chris Palmer at Harvard. And Dr. Palmer, a very interesting guy. He is a psychiatrist at Harvard, and he's the kind of doctor people go to when they've been everywhere else. So much like the wonderful Dr. Saul. People come from all over the country to see him when everybody else they've seen has kind of run out of ideas and they've thrown up their hands. And Dr. Palmer does a variety of things, but he's very, very interested in the ketogenic diet. So these two case reports are both patients with schizoaffective disorder, extremely treatment resistant. They picture people who've already been on clozapine, have had electroconvulsive therapy, and still didn't really get better. And in each case, one of the patients started out at about a 98 on the PANSS, and after a couple months on the ketogenic diet was down below a 50 on the PANSS. And that now, to this patient's delight, he also lost about 100 pounds because the poor fellow had gained, you can imagine after being on about 12 different, combinations, typical and atypical antipsychotic drugs, and he gained so much weight. And so he loses all this weight and then gets all the way down to like less than 50% of his baseline. The other patient went more like about a 30% reduction in the PANSS. So significant, not quite as much of a home run as the first guy. Also, interestingly, both of them had significant relapses to psychotic symptoms whenever they cheated on their diet. So that's if you go down the rabbit hole on the internet of ketogenic diets, you'll very quickly find cheat days. People want to have they want once a week or something, they want to go back to eating sugar. And that might be fine if you're, if the only thing you care about is body composition. But, there could be some suggestion that when it's for a therapeutic reason, people can relapse very quickly.
Wow.
If they introduce some of that stuff back into their life.
Yeah, that's so interesting. Well, I just have one more question for you. And that is, if you could share with us, because I know you have some personal experience with this, could you share with us what is the carnivore diet?
Well, it's exactly what you think it is. No plants. Right? And you're right. Full disclosure, I haven't eaten plant matter in a little more than a year now.
Wow.
It's been almost exactly 13 months. And the carnivore diet, or the animal diet, or the no plant diet, it's it has a lot in common with the ketogenic diet. Of course, when you go online, you'll see people in different groups fighting with each other. And if you work the ratios, some people actually consider themselves to be keto carnivore. So they eat only, no plants, only animal-based products, but they still eat a high enough ratio of fat that they still generate quite a few ketones. Quite a bit of what that's based upon, I'm increasingly convinced with what I've been reading and who I've been listening to, that there is no nutrient that is in a plant that you can't find in a piece of beef or an egg or some, especially if you eat organs. And that's probably basically your cow is the most complete nutritional source on the entire planet. And eating plants, eating fruits, eating fiber are at best redundant. I also do believe that at least for some people, they start to have some problems in their GI tract going back to permeability when they eat a certain amount of plant that might contain some molecules like lectins. And I see some variability. I think there's people who seem to be able to tolerate. I seem to tolerate those things just fine. I just don't care to. And then there are other people that if they eat certain kinds of plants for more than about a day, they do start having problems. And they seem to be able to maintain their health as long as they stick to only animal-derived food sources. There's a couple really interesting people to look up for you or for anybody who wants to go further down that rabbit hole. One's right in NEI's neighborhood, Dr. Paul Saladino. He's in San Diego. So that Saladino, and he's a psychiatrist. And he came to San Diego recently, and he is, absolutely an advocate of kind of the all meat, all carnivore diet, not just in terms of general health, but as a psychiatrist, specifically in terms of mental health. And then Dr. Eade, Georgia Eade in Connecticut, and her name is spelled EDE. She's been at it a little bit longer, but she's completely changed her practice now to nutrition. So if you look her up on the internet and find her website, and she has lectures on YouTube, and that's all she talks about also with inflammation and especially vegetable oils and seeds and some of those products that can, for some people more than others, get into the body and just cause all kinds of chaos. And that she recommends for most kind of going to a kind of animal-based food only sort of diet.
Wow. Well, thank you so much, Dr. Sauve, for joining us on this episode of the NEI podcast.
Well, thanks for having me.
This episode has been brought to you by the NEI Prescribe app. The most powerful tool for your prescribing arsenal is here. Based on the best-selling prescriber's guide, NEI Prescribe app gives you access to full prescribing details, including expert tips and pearls, more than 140 psychiatric drugs, and with the unique filter feature, you can identify treatment concerns specific to each patient in order to generate a customized list of possible medications to review. With full prescribing details for more than 140 psychiatric drugs, the NEI Prescribe app could help you in your practice. Go to www.neiglobal.com.